You know the impacts on rural healthcare are going to be devastating when a rural hospital in a county that went for Trump by 82% has the courage to stand up and speak out against the package of the BBB. Hey guys, my name's Will. This is the Back 40, and let's talk about it. I want to encourage all of you to read this article from Ozarks Public Radio. This article highlights the small rural hospital where I grew up in Bolivar, Missouri, and talks about the challenges that they're facing from the passage of the BBB, otherwise known as the Big Beautiful Bill. I grew up on a farm in Polk County, Missouri, and later graduated from Bolivar High School in Polk County. And Citizens Memorial Hospital, or CMH, is a large regional rural hospital located in that town. Now, just to give you a taste of the political atmosphere in Polk County, Missouri, in that county where I grew up and where I graduated from high school, 80.19% of the voters voted for Donald J. Trump. Only 18.63% of the voters voted for Kamala Harris and Tim Walz. This article calls out several key factors that we've been talking about on the Back 40 for months now. First of all, the spokesman from Citizens Memorial Hospital points out that their rural hospital in my hometown has been running basically at break even since their inception. That's important to know because these cuts that are coming are going to blow a $3 million annual hole in the budget for this local rural hospital. Now, I've told many of you my story before. I was injured in a major farm accident when I was a kid in Polk County, Missouri, and I laid out on the ground for an hour and 50 minutes waiting for help to arrive and to get the triage I needed to be taken to the hospital. Because of Citizens Memorial Hospital, if that same accident happened today, I'd be at the hospital in a little less than 45 minutes. That's the hospital that's in danger of having the $3 million budget hole blown in their budget because of the BBB. As you read through this article, you can see the tightrope that these administrators are walking. They know that Josh Hawley didn't do anything to save rural hospitals by getting an additional $50 billion dedicated to them. The administrator that's mentioned in this article points out that most of the cuts that are going to be coming because of the BBB don't even happen until year 5, 6, 7, and beyond. And the additional money that Josh Hawley stood out for, it's only going to be available for the first 5 years. You heard me right. When the biggest cuts actually happen, the 5-year bill that Hawley got passed, the supplemental for healthcare money for rural hospitals, will already be gone. Now, the administrator mentioned in this article, like I said, is trying to walk a tightrope. So he basically says maybe in their efforts to try to find tax cuts, they overlook the impacts of what would happen to Medicaid in rural hospitals. And I call BS on that. That's not what happened at all. They knew exactly what was going to happen if this bill passed. They knew what was going to happen to rural health care, and they knew what was going to happen to people in rural America who relied on Medicaid for their health insurance. That's why they took these half-hearted measures in the very end to try to scrape together some dollars to save rural hospitals in rural America. So for all of you out there in rural America that are doubting the impacts this bill is going to have on rural health care, here you go. These stories are appearing all over the country. Conservative rural hospital administrators stepping up to say that the ramifications of the BBB, the cuts to rural hospitals and the cuts to Medicaid reimbursements are in many cases going to cost us our rural hospitals. These aren't Democrats saying this. These aren't Republicans or independents saying this. These are the people that live and work in the community saying this. Their kids go to school with your kids. They sit in the same church pews that you do. Are you going to paint them with a political brush and ignore the warnings that they're putting out there for all of us to heed? I hope not, because what they're telling you is what we've been telling you. The impacts on rural health care are going to be drastic. And the worst thing about this bill is that they've put off some of the worst measures until after the next election. And why did they do that? Because they know if they would have implemented some of these measures right out of the gate, you would have seen the negative ramifications of these bills and you'd never vote to put them back in office in 2026. It's time for us to wake up, rural America. And if you want to join us in our fight for better healthcare policy, better policy for our rural schools, and better ag and economic policy to help our local rural economies grow, then join us at the Back 40. Go to the Back 40 Official, allspelledout.com, and sign up for our newsletter today. We have events occurring all over the country, and we're fighting to get the word out to save rural America.